Hello, everyone. This is Coresair Mack, President of the Illinois Mental Health Counselors Association. And today we're going to go over the ABCDE model of REBT. We're going to go over a little bit of history of what REBT is, as well as what is the ABCDE model, as well as how to implement it. So sit back, relax, enjoy the video. So here we're back at psychcentral.com to look at the ABCDE model as well as what is REBT. So first, REBT is rational emotive. All right, so first, REBT is rational emotive behavior therapy, or some people like to say rational emotional behavioral therapy, depending on which one you ascribe to. So Ellis developed REBT in the 1950s. The therapy says humans can act and think rationally, but when we think irrationally, those difficult or negative thoughts and feelings can get in our way. Another way to look at it is by thinking about how it isn't the event that directly causes emotions and behaviors, but it is one's belief about the event that leads to our reactions. So when we experience failure or hardship, we react with either healthy or unhealthy emotions and behaviors. And then gives an example here. So the COVID-19 pandemic requires many people to spend days quarantined. As a result, some viewed it as detrimental and began to experience signs of depression and anxiety. Others saw it as an opportunity to spend more quality time with family. REBT reduces the number of irrational thoughts and beliefs and increases rational thoughts and behaviors. As a therapeutic intervention, REBT may help treat many conditions including anxiety, depression, OCD, PTSD, social anxiety, and potentially even more. Right? So recent evidence shows that REBT can also aid athletes' mental health and performance. Most athletes experience some anxiety about competing, but some share more severe symptoms. Right? For example, a football player can injure their knee multiple times, causing severe stress and anxiety. With REBT, a mental health therapist can help to change their perception of the energy from a personal failing to something less harmful. Examples of less negative thoughts include, it isn't the end of the world, the knee will recover in time, I can return to playing football once I've healed. So now let's take a look at the ABCDE model of REBT. And don't confuse it with the ABC model of CBT, even though some of it is similar. But let's take a look specifically what the REBT version is. All right, so when you seek REBT for medical professionals, they apply the ABCDE model to your treatment. The A is an activating event that causes issues for you. The event can be a positive or negative event, a situation, a person, a traumatic event, or an unexplained behavior. The B involves your beliefs or thoughts about the activating event, and C represents the consequences of your beliefs about the event. And then it gives an illustration of the model, and we'll go into our own in a second here also. So a student feels anxiety after failing an exam. They might think, if I fail it this time, I'm sure I'll fail next time. As the dread sets in, they become shaky and their stomachs turn. In the context of the ABCDE model, the activating event is seeing a failed grade. The belief is that they will fail again, and the consequence is the physical symptoms they now have. Right, so in this example, the student's irrational belief leads to uncomfortable consequences. REBT therapy aims to help the person look at the situation more rationally by teaching them to remain optimistic. This can help reduce unwanted physical symptoms. So here's the second part after the model's ABC core. So we got D, dispute is when we question our belief. This might look like identifying the unreasonable or irrational belief, encountering ineffective thoughts with more helpful, rational, or constructive thoughts. Then E, the effective behavior, is the final step in therapy. It aims to achieve this step at the stage you have learned how to change your behaviors and can now resist future unhealthy behaviors. All right, so now let's get into some other applications of it. Alrighty, so now that we went over what the ABCDE model is, we could take a look at something really, really interesting. Because when applying this technique with clients have a hard time with coming up with the thoughts. Right, so one best strategy is to actually work backwards from C to A. So instead of trying to come up with the thoughts, you come up with the consequences, because there are even times where clients do not even know what the activating event is. So we find out what the consequences are, right? Whether it's physical, whether it's a behavior, or what have you, right? So for example, let's say the consequence is lashing out at people, right? So we take a look at that. We take a look to see, okay, you're lashing out at people. So when do you remember was the first time you've done this? Or one of the first times you've done this, right? You can either go all the way back in the past and do this, or something even more recent, like a week or a couple of weeks ago, right? To really identify when it first happened. And then we can really identify what the real activating event is, depending on what you guys have talked about before implementing the technique. So for example, the lashing out could have came from someone either calling the client stupid, or someone correcting the client and making a big deal out of it, or what have you, to where it would trigger that type of response. So then when we get into the belief or the thought, a lot of clients like to point outward with the belief, right? Or the belief, he did that to me, they did that to me, this is unfair, right? So on and so forth. But to really get into the core belief, right, which is the biggest thing here, we got to really point inward to see what the client truly believes about themselves in that situation, right? For example, I'm an idiot, I'm weak, I'm stupid, I don't know what I'm doing, right? Anything that will help show them what their core belief says about themselves to justify in their minds that negative behavior. Because ultimately, when we identify that core belief, it'll be really easy to dispute that belief. And it is really easy. All we got to do is just flip that belief on its head and take a look at the opposite of it, right? I'm smart. I'm not being taken advantage of. I know what I'm doing, right? So on and so forth. And then when we do that, we can also implement the new belief and then work off of that new belief, right? By showing facts to help support that new belief. And that way, if they get into that same or similar situation again, they will better be able to manage their emotions in that, as well as work themselves through that without the assistance of a therapist. All right, that's about it. Thank you guys very much for watching. If you guys are interested in making a YouTube video, interested in getting interviewed by one of us, or if you have any ideas you would want us to cover or things you want us to talk about, please feel free to either give us a call at 815-787-0515, or you can email us at myimca@gmail.com. All right, this is Coresair Mack, President of the Illinois Mental Health Counselors Association, signing out. Have a great rest of your day.